Hello friends, I am Dr. Sandipaa in my channel Homeopath. So I will be doing homeopathic videos, how to practice homeopathy in a classical way and what are the rules we follow in practicing homeopathy. So in this session friends, how to approach mental cases. That is, there are so many depression patients and there are so many mental patients. How to approach this group of patients by homeopathic medicines and how to cure the mental cases, depression, OCD, bipolar, you name it, and we can treat that. Simply because Hahnemann has made a group of rules to treat these mental symptoms. So as you go through the repertory and materia medica, the confusion is more. But if you go through Organon of medicine, you will be more clear and you will have a very proper way how to treat these mental patients. So as you treat the physical group of symptoms, mental symptoms are also being treated by homeopathy. So Hahnemann has given a separate aphorisms for those group of diseases. How to treat mental diseases. 210 to 216 aphorisms, he explains how exactly what is the modus operandi of treating mental cases. So I applied the same rules and I have already cured few mental patients. They are healthy and happy and enjoying the life properly. So that is the way one can treat mental patients, friends. So first rule what Dr. Hahnemann in his aphorism he tells is, whenever you get a mental patient, it is as good as a physical disturbance. So you must not exaggerate the things. You take note of all the deviation from healthy state to now diseased mental state. So once if you have a proper listing of all the problems, of all the symptoms of these mental patients, you can go through the repertory and pinpoint each and every symptom in our repertory and materia medica. Only one confusing thing in these mental patients is they will give a lot of symptoms, lot of fears, lot of angers, lot of sensitivity, lot of things. So a good homeopathic physician will be very keen in observing, making the symptom note of, taking note of it and taking as a rubric. So these three steps are very important, friends, because these mental patients and every patient will be boosting so many things simply to get rid of all the things at a time. So we must be very conscious of which is common, which is uncommon, which really help us to find the total individuality of the patient to come to the simillimum. So this is one aspect. And Dr. Hahnemann in his aphorism, he tells that first you must calm down the total symptomatic presentation in the mental patients by using mercurius, belladonna, stramonium, hyoscyamus. So these are the few medicines he recommends in his Organon of medicine. By giving in higher potency of these medicines, the patients will become calmed down and he will be having some integration. So once he has the integration, you will be in a proper position to pinpoint his simillimum. By that time, you must be in a position to find the simillimum what the patient requires. So that once if you give an antisoric medicine, a chronic antisoric medicine, a wavering thought, a wavering fear, a wavering anger is totally settled off, and if you give a proper indicated simillimum for the patient will be cured. He will be cured of his fears, he will be cured of his anger, he will be cured of his total attitude towards the disease, total attitude towards the life, and he starts working regularly, and he starts respecting his people, he starts respecting his parents and his surroundings, and he starts taking the actions what a normal human being does. So this is the first criteria Dr. Hahnemann tells. So there will be no time span gap to be given between first medicine and the second medicine. So first medicine is indicated to calm down his total emotional state, mental state, and his fearful state. Once he is calmed down, then his required antisoric, antipsychotic, antisyphilitic, whatever the medicine his simillimum is demanding, if you give in the higher potency I mean to say it is even 200 is a higher potency. Don't go for 10m, 50m, 1m, cm, lm. So this is all to be observed. Even 200 work wonders if the medicine is proper. I have seen friends. So these are the two rules. If you can follow and approach the mental patients, you will see wonders. And it is the only capacity of a homeopathic physician who can treat depression, bipolar, and any of the mental states, simply because we have an exact picture matching in our repertory, in our materia medica. But that is a 50% of a thing. But how to give it, when to give it, and how to repeat it, this is the very important aspect one physician must always focus on. So that is what given in Organon of medicines. So if you can follow these set of rules and approach the mental patients, I hope and I guarantee you that you will also get the success in any of the mental patients, friends. So this is what I wanted to talk about today's session. If you like this video, please like, share and subscribe our channel. In future also I will be doing such videos. If you have any queries, please put in the comment section so that I can answer those questions. I will also grow with you. Thank you, friends. Take care. Bye.